Every day brings another story about the depth of this country's opioid crisis. Overdoses up, emergency services overwhelmed, another family burying a loved one.
Nationwide, the opioid crisis is raging. The overdose death rate now the highest in U.S. history.
The federal government was negligent in allowing us to get to a point where you had hundreds of thousands of opiate prescriptions. You had more opiate prescriptions in the state of Ohio than people in the state of Ohio. And that was on the government's watch. And then we somehow hold individuals accountable for becoming addicted when you had companies that profited to the tune of tens of billions of dollars. Right now, we have to own up to our own government's failings and responsibility and say, look, this plague is our fault, at least in part. So we need to put the resources to work to help people get well, even though this is not a monetary problem, it's a human problem. But then the second thing is we have to stop punishing people for becoming hooked on these drugs. We have to say, look, if you're an addict, we're going to refer you to treatment and not a prison cell.
Portugal is a small country, about the same size as Maine. But its drug problem is significant. At one point, hundreds of people were dying every single year from opioids. But now that number's been cut dramatically by 90%.
They decided to set up a panel of scientists and doctors. The panel went away, looked at the evidence, came back and said, decriminalize all drugs, from cannabis to crack, but take all the money we used to spend on arresting and imprisoning addicts and making them worse, and spend it instead on making them better, on turning their lives around.
I was inspired by Portugal's success, where in the wake of this change in approach, they saw a massive reduction in both overdose rates and substance abuse rates.